I'm professional in pharmacology and therapeutics studies. Sorry, Professor Goddess Prince, can you please explain for me the mechanism of action of antihypertensive drugs in the body? Or how does the antihypertensive drugs works in the body? Explain each hypertensive drugs with their examples of drugs in each class or groups of drugs.
Accordingly to my professional Mr. Goddess Prince, first all I'm Professor Masania. The drugs of hypertension depends on how does it works in body by several mechanism, and the following are the classes of antihypertensive drugs and how does the drugs works on body in each class. First class is angiotensin converting enzyme inhibitors, ASE. ASE act by inhibiting the conversion of angiotensin I to angiotensin II by suppress kinase 2 activity and thereby increasing vasodilation of blood vessels, hence lower blood pressure. 2. Beta blockers act by inhibiting renin secretion and epinephrine, which reduce heart rate and cause hearts to beat slowly and with less force, which lower blood pressure by widen veins and artery. 3. Angiotensin receptor blockers. Angiotensin II receptors agents work by inhibit the action of angiotensin II by preventing angiotensin II from binding to angiotensin II receptors on the muscles of blood vessels, which dilate the arteries and veins, hence reduce pressure. 5. Calcium channel blockers. Calcium channel blockers act by inhibit Ca2+ entering the cell of the heart and arteries in flux through voltage dependent, therefore relax arterial or smooth muscle, which reduce peripheral vascular resistance and lower arterial blood pressure. V. Diuretics. Thiazide diuretics. Thiazide act by inhibit reabsorption of sodium and chloride ions in the proximal part of the distal convoluted tubule. 6. Alpha-adrenoceptor antagonists. Alpha-1 antagonists cause vasodilatation by block alpha-1 receptors on vascular smooth muscle, blocking this tonic action of noradrenaline. Hence alpha-1 adrenoceptor antagonists lower blood pressure by causing the relaxation of both arterial and venous smooth muscle. 7. Centrally acting drugs. Methyldopamine act after being uptaken to central neurons and is converted into false transmitter alpha-methylnoradrenaline, which decrease the outflow by alpha-2 agonist action from CNS, leading to reduction peripheral resistance and decreased blood pressure.